The recent study conducted by the University of Oklahoma has unveiled a concerning connection between iron deficiency and cognitive performance in women undergoing menopause, shedding light on a topic that has long been overlooked in medical research. Although iron is well known for its role in blood health, its influence on cognitive function, particularly during the menopausal transition, is a new and troubling area of concern. The findings, published in the journal Nutrients, suggest that women with insufficient iron levels in their blood may experience notable cognitive impairments, including confusion and memory lapses, exacerbating the already challenging nature of menopause. The study highlights a critical point. While iron deficiency is commonly associated with anemia, its cognitive impact can occur even when anemia is not present. The research revealed that many women, although not clinically anemic, had lower than expected iron levels for their age, which directly correlated with poorer cognitive performance. This is particularly alarming considering the cognitive changes women experience during menopause, a phase that already brings a slew of symptoms such as hot flashes, mood swings, and sleep disturbances. Adding cognitive decline to the mix only compounds the emotional and psychological toll of this natural life stage. The results are stark. The study found that a deficiency in iron can slow reaction times, affecting simple tasks like pressing a button in response to a visual stimulus. While a delay of 150 milliseconds might seem negligible, it can significantly impact daily functions, especially when accumulated across many tasks throughout the day. This seemingly minor delay can hinder a woman's ability to communicate, make decisions, and manage everyday responsibilities effectively. The impact on quality of life is undeniable, and yet, this issue remains largely unaddressed within the medical community. The research also underscores the importance of iron in producing dopamine, a neurotransmitter that plays a vital role in both cognitive and visual functions. This relationship suggests that women with inadequate iron may not only face difficulties with memory and concentration but could also experience visual disturbances, further adding to the confusion and disorientation they might already feel during menopause. Given that dopamine is also crucial for regulating mood and emotional well-being, it's evident that low iron levels could exacerbate the emotional volatility many women experience during this transitional phase. Despite these findings, the issue of iron deficiency remains underdiagnosed, particularly in women undergoing menopause. Dr. Michael Wenger, the lead author of the study, pointed out that many women do not undergo specific tests to measure their iron levels during routine gynecological visits. This oversight is concerning, as identifying iron deficiency early could help mitigate the mental and cognitive challenges that many women face. Without routine testing and awareness, women may continue to suffer without ever understanding the root cause of their symptoms. While the connection between iron deficiency and cognitive decline is concerning, it is not necessarily a death sentence. The good news, as noted by the researchers, is that correcting iron deficiency does not seem to lead to harmful iron accumulation in the brain, which could pose a risk for neurodegenerative diseases like Alzheimer's. This finding is crucial because it means that managing iron levels in the blood is a safe and potentially effective way to improve cognitive function without the risk of exacerbating other neurological conditions. However, this does not diminish the severity of the issue. The fact that iron deficiency could be contributing to confusion, memory loss, and even visual disturbances for women going through menopause is a stark reminder of how overlooked this aspect of women's health is. In addition to the more commonly discussed risks of menopause, such as osteoporosis and heart disease, cognitive decline should be given far more attention. If left unaddressed, it could lead to significant long-term consequences for women's mental health, independence, and overall well-being. There are challenges, of course, in addressing this issue. Many women are hesitant to take iron supplements due to the potential side effects, including digestive issues such as constipation or nausea. However, Dr. Wenger suggests that smaller doses or dietary adjustments could be an effective and safe way to improve iron levels without causing these unpleasant side effects. Such interventions could provide a simple yet impactful solution to alleviate some of the cognitive burdens associated with menopause, making the transition to postmenopause more manageable for many women. What remains particularly concerning is the lack of awareness around the cognitive impacts of menopause, compounded by the failure to routinely test for iron deficiency in women during this time. As Dr. Pamela Miles, co-author of the study, pointed out, while we know a great deal about the long-term risks women face after menopause, including cardiovascular diseases and osteoporosis, the transitional phase itself has been largely neglected in research and healthcare practices. This phase, often one of the most difficult for women, deserves far more attention from both the medical community and society at large. In conclusion, the findings of this study should serve as a wake-up call to healthcare providers and women alike. Iron deficiency during menopause is not just a minor issue. It is a potential factor that could significantly impair a woman's cognitive function and quality of life. The failure to address this issue, especially when simple interventions like iron supplements or dietary changes could offer relief, is a missed opportunity for improving the health and well-being of millions of women. It's time for the medical community to take this seriously and for women to advocate for themselves, ensuring that they are receiving the proper care and attention during this crucial stage of life.